I'm going to open it with Gary Whittle. It's your committee that's kind of got this going, and Gary, you'll introduce these people and go forward from there.
Okay, thanks. We have been working with Cindy Matthews and Mike Powers, I'm sorry, on looking at the operational assessment that we had an agreement with them earlier on. I want to let everybody know, or everybody knows that we've only been an authority since January 1st. So I think we've done a lot of things with the town hall meeting that Angie and her committee set up. And I think that went well, was well received by the community. And I think one of the things that people wanted to see, and when I say people, it's a general statement. How many, I don't know, and I don't think any of us do, but we did as a board wanted to look at an operational assessment and have a third party to come in and do an operational assessment for us. And so we've done that with community hospital consultant, and Cindy and Mike and their whole team has worked closely with the staff and have completed it. And they're going to have Cindy and Mike go over their findings as far as the operational assessment and the key recommendations. There's some things that when the committee with Ernie and Sharon, of course Sharon's not here, I apologize for that, but when we looked at this, when we had the meeting and looked at this, there was a lot of things that we felt were doing good. There were some things that we know as a small rural hospital that can be improved. And that's why we want a third-party assessment to help us out on that, to identify some things, and staff has already been working on some things that they found out. So at this time, I'd like to go ahead and turn it over to Cindy and Mike, and what we'd like to do is have them to go over the assessment with the recommendations that they have, also any comments from the staff that they might have, and collaborate with closely together. And Cindy, if you would like to go over that.
Absolutely.
Cindy, do you want us to hold all the questions and comments until you've gone through the whole thing?
You know, we're happy to be interactive. You know, so if you have questions as we go through, it's probably best if you ask them, and that way we'll remember all of them as we go through, if that's right. Well, thank you all so much for having us this afternoon. Mike and I are pleased to go over a summary of our results with you. First of all, let me tell you, it was a delightful engagement. The staff was very, very cooperative, very giving of data, and we know that some of the data was not easy to gather. So we really appreciate Gary and his team's work with that. The other thing I will say is that after we've talked about some of the recommendation, we have gotten phone calls from Gary and his staff asking more detailed questions and things that they could go ahead and begin to work on. So we appreciate that too. Some of our engagements aren't quite as delightful. So we were very pleased with how this one has been. Well, let us talk just a little bit about our approach, the areas that we looked at, as well as our recommendations. The assessment focus was really taking a look at the marketplace. We looked at a lot of depth about the hospital, the competitive environment that you are living within. We looked at financial trends. We looked at something called revenue cycle, and for all of you who might not be in depth in the healthcare world day to day, revenue cycle is really that process with the hospital that happens with a patient from the moment that they schedule all the way to when the bill is dropped. So it's that whole business office kind of process. There are a lot of processes that take place there to make sure that patients are being billed appropriately, that the hospital is collecting what the hospital needs to collect, that charity care policies are intact and those kinds of things. So that was revenue cycle. We looked at supply chain, and supply chain is really that whole process of bringing in materials and supplies to the hospitals. It's a very complicated piece of healthcare. Each hospital has what's called a group purchasing organization. That group purchasing organization is what helps hospitals save money. And so we always want to look and say, is the hospital optimizing their group purchasing organization, or are there some issues with that? So that's supply chain. We looked at managed care, and as you all know, managed care is that whole contracted relationship with your insurance companies. And so we looked at the managed care contracts and have some recommendations along those lines. We always try to look at insurance risk. That's sort of what's hanging out there that could be a liability issue. So we looked at insurance risk, and then we also did some human resource review. And with human resource review, we looked at benefits and retirement programs and sort of the strategic initiatives that the hospital has from an HR standpoint. All right, so those were all of the different areas that we looked at. Now, in terms of our approach, I will remind you that with our original proposal to the hospital, we really had sort of a two-phase approach with the operational assessment. And the first one was desktop. And so all of the results that we're going to talk about today are our review on a desktop basis of data. So this is a lot of data review. You will see when we get to recommendations that there are some areas that we have said, an on-site assessment of those might not be a bad idea. But I want you to understand sort of what we'll be looking at from a standpoint today, and it is all of that data review. These are all of our team members at CH Consulting who had a hand in our recommendations. Basically what we do is we take our content experts and have them review the data that it goes along with that particular area. So for instance, Tony Ybarra, who's right here, Tony is our VP of Supply Chain. So Tony was really the one who analyzed all of the supply chain data. And so we did have several of our CHC team members who participated in the review. What we want to do now is just go over each of the different areas. We've put it together sort of in a stoplight fashion, which we always like to do looking at quality data or any other kind of data, where we've got green, which means all points go, yellow, which means, maybe some caution, and caution just means maybe a little bit more of a need to evaluate, or hospital leadership keep that good focus in that area. And then red are those areas that we see are a little bit more of a vulnerability. Okay? So I'm going to turn over to Mike to walk through, and I will interject because I have a hard time not interjecting kind of as we go through the process.